Very good evening to everybody, and I welcome you to this very special edition of Eclectica, the Different News. From this time, for the coming certain episodes, I am starting this initiative today as a special series on people, rather dentists or dental students or faculty or anybody in the field, okay, who works a little different, who thinks a little different. So this is the dental scientist series in Eclectica, and I welcome all of you here who have joined us in the live session. Well, I will not introduce today, to my guest. Don't worry, I'm not going to speak, but I have two very interesting young minds who are waiting in the backstage. I will give a little thread of the story, and then we will hear their fascinating journey right from them. So these are two friends, or it's kind of a senior junior duo, who came up and they thought that something different can be done. So they came up to build a three-dimensional model of something called as tumor microenvironment of oral cancer. Well, if you're not aware of this terminology, that's okay. What I'm trying to say is that these things we can see only under microscope. Like if we put eyes in the microscope, only then we can see something. We see cells, we see stuff, okay, and then we analyze. But what these guys did, they made it visual. And so now, without wasting any more time, let me call in the two very handsome guys you will be watching now today with me. So here I call in my very lovely guest, Dr. Sourendra and Dr. Kuldeep. Very good evening, Sourendra and Kuldeep, and I welcome you on my show. I'm very happy that and glad that you are here today to share your fantastic work, and we are all very excited, and I see all the audience are excited too. Thank you so much for accepting my invitation.
A very good morning, ma'am. Good evening, ma'am. Thank you, ma'am, for giving us this wonderful opportunity. Myself, Dr. Kuldeep Singh, and I am a third-year student in Maulana Azad Institute of Dental Science in Oral Pathology Department. And I did my bachelor degree from the same college in 2018. Then I joined the junior residency in 2009, and in the mid of my junior residency, I cracked my NEET MDS and then came
Great.
in the same college. Then in the mid section of the MDS, I did my fellowship in forensic odontology, which is held by
Mhm.
the IPFO. And currently, I submitted my thesis on the molecular level. We diagnosed or we find the expression of different microRNA which are participating or significantly upregulated in the OSCC and participate in the progression of the OSCC and the proliferating cells and different. And from this thesis, we have an idea for our model, which is we are trying to depicting the microenvironment of the oral cancer through a 3D model, so that the juniors or the BDS student or the student which are currently not know much about the oral cancers, then we are thought that we depict the environment in a 3D model to better understand for the juniors.
Fantastic. That's Thank you for that explanation. And Shorendra, I'd also like to know about you and tell us more about you. And then I think I have a lot of questions to ask to you, and take your perspectives, because you are the future who are working now. So I think it will be a very interesting session. Yes, Shorendra.
Good evening, ma'am. Thank you for this fantastic opportunity that you gave us to showcase our work because what I have learned so far, showcasing your work is very much important in PG because you learn how to document things and how
Right.
to document your work or whatever you do regularly in the clinic
Correct.
or in the hospital. So, ma'am, I hail from West Bengal and I completed my Bachelor's of Dental Surgery from Dr. R. Ahmed Dental College and Hospital in 2017. And
Okay.
after completing my internship, then I joined the same college, the same hospital as a house staff. And I
Mm-hmm.
have done my house staffship in Department of Oral Surgery, Department of Conservative Dentistry, and Department of Periodontics there for
Okay.
long 18 months. After that,
Mm-hmm.
I established my own dental clinic and I ran it for 3 to 4 years. And in between the practice, I continued my preparation for MDS, and then I cracked MDS in 2021, and I got my chance in oral pathology in Monash Institute of Dental Science, one of the most premier dental institution in our country. So that is my background. Currently, I'm doing my thesis for artificial intelligence-based algorithm development for cancer detection, and also there are 2 to 3 side projects going on.
Fantastic, Sourendra. Very nice to know you. And yes, I think we have two things in common. One is direct, one is indirect. One direct is that I also hail from Bengal, so I am Bengali by birth. So that's a good thing to know. And second thing is R. Ahmed is something related to my dad. I think he was alumni long, long back. I think he was the first or second batch, maybe. So maybe you, if you ask the very senior people, I think I don't remember all the names, but I think they will be knowing about my dad well. So because whatever I do is his inspiration, so I that just tickled my emotions really. And very nice to know that you are so into academics, and you, I think you had a tough time to do crack MDS need after while practicing. That's not an easy job. Well then, so
Yes.
I think we have two fantastic people, and I think all our all our audience are very, very excited, and they are continuously messaging, which is fantastic, which is very, very inspiring. So let's take this conversation ahead. And well, so I understood that you have done your BDS and stuff. So generally, what I this my knowledge, like when we see, when it comes to BDS, when we have to choose MDS, I think most of the people, well, I might be wrong, this is not a general statement, this is just my perspective, that most of the people would like to take up kind of masters in surgery or maybe perio or and stuff like that. So you have chosen to study masters in oral pathology. So my quick question is to both of you, and one by one we will see that we will listen from you, that is this by chance or by choice?
And for me, it's by chance, ma'am. Frankly speaking, it's by chance. But in the after entering in the oral pathology, I'm learning so much things, and I'm give my interest or give my time or invest my time in the learning the new things like research based, it is whether molecular level or in the artificial intelligence. These are the new terms which I learned in after getting in the oral pathology.
Ma'am,
Fantastic.
for me, it was by choice because during the counseling period, I got endodontics in my own college, and
Mm-hmm.
I also had the option to join as a PG in Monash, the Institute of Dental Sciences. Now, I have already worked there for more than 7 years. So I thought I
Right.
should explore some new option, and oral pathology. I knew that uh, aside the regular general therapeutic dentistry we do day by day, if you want
Mm-hmm.
to go for the research field, oral pathology is a very fantastic field because in oral pathology you see patients, you definitely see patients. You handle the regular biopsy works and reporting and all that. But apart from that, you get a ample time to invest your time in doing research and other works also, and you
Right.
get to learn new things.
Correct.
So that was the main fascinating thing about me joining oral pathology.
Very nice to know. Nice to know both of your thing. And I must appreciate Kuldeep. He's so candid that he said, okay, it was by chance. I mean, that's really nice. That's very sweet. Well, so here is another question which kind of travels on air when it comes to oral path. Like you mentioned, you gave a hint in your last answer also. Like that is a prevalent myth that runs in the dental fraternity, is that oral path is a non-clinical subject and the career scopes are limited. So you both being into the game, what is your opinion on this? I would really love to know the people who are inside the game. Yeah.
Ma'am, actually, what I respectfully disagree with the concept that oral pathology is a non-clinical thing because when a patient comes to a dentist,
Mm-hmm.
so the dentist's duty is to diagnose why the patient is having pain or swelling or anything, and then the patient treats the disease or the patient. Now, in oral pathology, patients also come to us or the specimens comes to us. We
Mm-hmm.
analyze that thing. We inquire about the patient's clinical history, patient's drug history, patient's medical history, And I must say that in our department there are some fascinating cases I have seen, that when we thought that provisional diagnosis will be something else,
Mm-hmm.
but the ultimate diagnosis after doing IHC, molecular studies, or some very minute histopathological parameters we regularly see under microscope, that ultimately changed the whole thing into something else. So this is a common phenomenon in our department, and it happens. So it is very much interesting. So I respectfully disagree with the concept that it is a non-clinical branch. Definitely, there is a little bit of less patient work, but the lab work is much more. And
Mm-hmm.
sometimes we stay around 5 to 6 p.m. also in our department to do our day-by-day work, or if we are interested in some other works, we also continue our work like that. So there is ample scope of research, and
Mm.
also if you want to invest your time in learning how the disease is progressing, how to diagnose
Mm.
any new case, or how to report in a new thing, there is ample scope of research and practice in oral pathology.
In
Right.
the current scenario, we can go for the surgical pathology also, like FNSC and the ultrasound guided FNSC. We can do it frequently in our clinic.
Right. I think I think just demarketing a subject that way is not a good idea. I feel personally that, like when you were not into MDS, whether by choice or by chance, you had no idea what's going on here. So I personally feel that, particularly oral path, it is a stream which gives you direct access to get inside the pathology, very much inside the cell, and it broadens the horizon. It gives a clinician a more holistic approach to see a case. This is well, I'm not biased with any any subject specialty that way, but I personally feel that this is something which is little different from any other branches that are existing in dentistry, to be very honest, yes. So well, that's very nice opinion, and very I appreciate your thoughts. So one thing I would like to really ask you, because something, when we talk about research, particularly to dentists, I personally feel that there is a kind of less understanding, or maybe they are not exposed to the correct curriculum or the knowledge resources. So one question is that dentistry is what I have seen, because as you know that I have been trained I'm a trained molecular biologist, by the way. But then, yeah, when I did undergraduation in dentistry, yeah, I understood that it is very technique oriented profession, like according to the curriculum. I'm talking about general dentistry, the BDS. So do you think understanding research is necessary for a technical professional course like dentistry? What is your opinion?
Ma'am, I think going for understanding the research methodology is very much important. I will just give you a simple example. During my house surgeonship in RM Dental College and Hospital in Department of Surgery, I have conducted around 86 to 90 impaction surgeries. But
Mm,
unfortunately, I don't have any kind of patient documentation except for some radiographs or some extracted teeth like that. So
mm,
if I would have an exposure before that, that in research field we can showcase our work, we can publish our work, which can basically educate other scientists or other people. So that would have been a different story for me.
true.
So I always tell my interns or my juniors that no matter if you are doing PG or not, if you are in an undergraduate also, you should
Mm,
always know how to document your case. You should always know how to take a simple photograph, intraoral, extraoral, anything, how to capture the radiograph so you can publish it, you can showcase your work. Because ma'am, whatever we are doing, publishing is a very important thing.
absolutely, I agree. Yeah, yeah. So I think that's a very very good point that you have told, Shorendro, that it's about documentation. It is about publishing, and beyond that, what I see is, like, it is more about educating people who need this guidance, because as you
Yes, ma'am.
said, you talk to your juniors or interns, because if something that, like you said, so many impactions, so I think each experience will not be, I'm sure that all of the 70 or 80 were different experiences. So today,
Different. Absolutely.
perhaps you could have documented, and if you could have really collected all the data, so you might have, come to a conclusion which would be really helpful, even in the treatment perspective. So I think that is where it's very powerful to understand why we really need to do research. And I think when this terminology comes in the room, there's some kind of that we critically we demarcate. But I say that science, we cannot demarcate science. It's just altogether, so well. Now coming to the very interesting thing, which I have been very very inquisitive myself, that you told that you made a model, 3D model of the tissue section, or about the tumor microenvironment. So please tell us more about that. Both of you can just join in and tell. Yeah.
Ma'am, first we focus on the difficulty which we face together to depicting or to prepare this model. First of all, we
Hmm.
have difficulties to choosing the material. That
Right.
what kind of a material we have to use, which is easy to use and manipulating, like the structures we want to depicting the micro environment in the tumor cells,
Mhm.
and the application of the 3D model, like the material and the model and the machinery we used. How can we use the easy and cheap, we
Correct.
think, from the all aspect of the model for this, that then finally we decided to choose the hot melted, which can be easily moldable, like we use the glue gun. We use the hot glue gun material, glue gun sticks. Then we allow to set it after for long time, and give
Mhm.
it definitive architecture, which is depicting the our environment, our microtumor environment, the
Mhm.
definitive cells, the definitive vessels, and other things like multinucleated giant cells, and
Right.
other kind of cells which have different shapes and size. We have faced the many difficulties, and
Actually,
oh,
ma'am, what I
wait,
would like to say is back in June
ma-
or July something, I think. So our HOD ma'am, Dr. Aditya B.
respect.
Ars, respected HOD ma'am, she called us and told that we are having a conference in IOMP Dehradun in November, and
Hmm.
you should try to make a model. So
Okay.
we first had so many plans in our mind, but after discussing with our faculties, we
It's
chose
more
that
modern.
we should do something which will be a
Hmm.
little bit difficult to make, but the concept will be mesmerizing. Now,
Hmm.
understanding the concept of oral cancer, which I have found difficult, because
Correct.
when I joined oral pathology,
Hmm.
so many things are being taught in my class, in my discussions, and I have a very vague idea about everything. So whenever I go through the book, they are only showing histopathology slides. So how this histopathology slide, that thin section is coming, it was very difficult for me to understand.
Right.
So I thought that I should, now I have understood everything. Now I
Hmm.
should make a model so that any undergraduate student or even a first year BDS student can understand how we process the tissue, how the thin section is meant, and if
Hmm.
we join all these thin sections, then ultimately a tissue will be formed. So from
Correct.
that perspective view, and our deep knowledge in histopathology of our faculties, they have helped us a lot. I want to quote my HOD, respected HOD, Ma'am Dr. Aditya B. Varis, our Professor
Faculty,
Dr. Jasilan Augustine.
Dr.
He
Priya
is my
sir.
thesis guide also, and also we must mention Dr. Priya ma'am, and
Hmm.
all of our faculties, and Dr. Bhaskar sir also. All of our faculties have helped us so much in developing this model, and they
Hmm.
have taught in at every moment that what modifications are required to be done. Like sir has said, that
Not
material selection was a very crucial part in our
Correct.
project, because
Right.
the molding part, we cannot use any 3D printing product for this, because the model has to be made by
by
us
hand.
only. So our hand worked like a 3D printer. So basically, we know how the tissue structure is there. We,
Hmm.
for our histopathology course, our pathology course,
Pathology.
so we draw histopathological diagrams also.
Hmm.
So using that concept, we made this model where tumor cells are being shown, how the invasion is occurring into the connective tissue, that were being shown, how neoangiogenesis is occurring. We have also shown that, and as Sarah explained, that different types of cells, where morphology and cellular at architectural and cellular level is very important. All
Hmm.
that features are shown in our model.
And all the technical credit goes to Dr. Basu. He made it like bright and light fit. He
Uh-huh.
fitted the light which are directly connecting to the depicting the model, like the blood
Hmm.
vessels. In the blood vessels, he used to put only the red light. In the main model, he used to green lights for depicting the fibroblast, and he used the violet light to depicting the our inflammatory cells. All
Uh,
credit goes to the Dr. Basu technical point of view.
Wow, this is amazing. I mean, I think both way it worked for you. That without with see, this is the best part, that you have got fantastic mentors. Because without mentors, without a guided path, it is very difficult. Even if we have some good ideas to translate it into reality. So I think that way you are very blessed. And I really appreciate the way your faculties have pushed you through this,
Yes.
because otherwise I think you would have done just something which usual presentation it would be. But I think this is awesome. This is awesome. So I think it is a journey by itself, what you have done through by building this model and this experience of yours. I think I'm not sure how you document it, but I think this should come up. This should come up, and because this is very inspiring for many people. Because it's not an easy thing that you have done. It's a very difficult thing, but it is very very useful. So I think when it comes to education, because I'm an educationist, so when it comes to education, I think this type of stuff, if we can do more, it gives better understanding of the subject to the student. It's not only about being a master's, but as you said rightly, that even undergraduate student can understand. Only then they will get more clarity, and they will be better doctors in that way. Yeah,
Yep.
fantastic.
Yes, ma'am.
It's
Very
our
nice.
job. It's
Yes,
our job to make the subject interesting, and particularly for the BDS student
And
in
also
the
to make the learning easy.
uh,
very nice.
after
I think
dental.
once you complete your MDS, and I'm not sure which what you choose, but I think you both will be very good teachers. So because you a good teachers, the first symbol is that you think for the betterment, better understanding of the student, because that is the moral duty of a teacher, to give the information in a very nice way to the student. So well, I think you told about the challenges, all like most of the challenge, but still I think while taking up this project, you have rather than, I mean, apart from what you told technically, did you face any other challenges? If so,
Yes.
and how did you solve them? I would like to know.
Ma'am,
The
time was a very crucial factor for us
sorry.
because the model was quite big.
And the
So it
heavy.
is and heavy also.
It's too heavy, ma'am. It's
It was very
Oh,
difficult
difficult
to
for us to carry that and
from
take to
Delhi to
Dehradun, from Delhi to Dehradun. It was a very difficult task for us because we
huh.
are always having a fear that any part might get broken. So we also carried our instruments with us if any kind of electronic or last moment modification is required, so that we
we
can go
can
there.
get.
So I actually had a little bit knack in electronics and technical things. So that
Okay,
sort of can help me a lot in this overcoming these difficulties. And
fantastic.
also our faculties have inspired a lot. Every moment they have been supported
Supported
throughout. They have
Hmm.
every
each and
moment,
every moment.
each and every moment they have supported throughout us.
Amazing. This is really, really, really nice to know. And the enthusiasm you had, because most of the people might not, they might get ideas, they might try, but till the end, taking it till the end, it needs a lot of passion into it. You must have loved what you did at that moment. I guess so. So, well, um, so since we're talking about research, and we started our conversation that way. So what is your idea of interdisciplinary research in dentistry? What do you think about it?
Ma'am, like in my thesis, I have learned that there is a interdisciplinary. Like I have worked in the department of the micro chemistry for my thesis, and now I am currently working with the department of microbiology for my current project on AI, which detect the candida. And
Okay.
then it is absolutely right and very important to to uh, take the all the subject or the department with the pathology.
Actually, ma'am,
And
what I think is interdisciplinary research is very important for us.
Hmm.
For example, if I talk about my recent project in understanding the erosive effect of acidic beverages. So I'm
Okay.
currently working on the manuscript of that. So for that purpose, we have done scanning electron microscopy in fewer samples. And
Hmm.
for that purpose, we have been in collaboration with the nanoscience department in Jamia Millia University, and
Right.
it was a great opportunity for me to visit their scanning electron microscopy lab. So for this kind of purposes, we should definitely go for this interdisciplinary researches where multiple peoples from other discipline can come together
Hmm.
and develop
Hmm.
an idea. And I think in the diagnostic purposes, if we go,
Hmm.
artificial intelligence is
intelligence.
a very common term today, but it is very difficult to develop detection algorithm for
Yeah.
a dentist or doctor. So for that purpose, we need to share our knowledge with the experts in their field. So
Absolutely.
that's why I think interdisciplinary research from the molecular aspect, from the computational
Genetic,
pathology aspect, it is very
Hmm.
important.
genetic
Correct.
also.
Correct.
Genetic.
Correct. So, well, I think that's really nice thoughts that you have. Now that we are coming almost to the concluding part of our conversation, but it is very interesting. I think we should talk again because I really don't want to leave you now. But then that's how things goes. Well, where do you see yourself 10 years from now?
Ma'am, frankly speaking, I have already conducted established my clinical practice and run a clinic.
Right.
So I know the ups and downs of how to establish a clinic and go through different types of experiences in that. But the
Uh-huh.
experience is not bad at all. But still, I think I have much more. After joining oral pathology, I have grown a vast interest in the field of research methodology and doing researches in the field of artificial intelligence and computational pathology in pathology. So, in
Mm-hmm.
the field of oral pathology, I would like to apply these knowledges and I want to learn more and work more based on these things. And also, genetics in oral pathology is very interesting field and very less is known till date. So much more to know, learn about all the disease pathogenesis, because if we know about the disease pathogenesis, we'll be able to detect it early, and earlier
Exactly.
detection can lead to development of better treatment plan and treatment strategies, and patient survival will be better. So research, I think I will be in research only.
Great. That's very nice to know. Yes, Kuldeep,
Yes.
where do you see yourself 10 years from now?
Ma'am, first of all, in the first half of my MDS, I'm not
Hmm.
at all interested in the research project and interest, and
Okay,
I don't
same.
like these things. But at the end of the masters, I'm uh, I'm interested in the research work, and I want to become a scientist in next few days, in next few
Yes.
years, and I love to research or giving the new ideas or new things to the country.
Fantastic. I think, this is a very good thing. The type of vision you have. And I love Kuldeep. About one thing about Kuldeep is that he's very honest and very candid. He doesn't hide anything. He's like, I didn't like oral pathology at the beginning. It was by chance to me. But see, the life is,
But
life is like this. And this field is when you really see science as a whole circle, it will always be fascinating because it will offer you opportunities, like just as you said. So I think and as you said that you want to become a scientist, or Sourendra said that he also wants to be in research, but I think people like if you come up more and you take these things to the next level. And nowadays government of India supports a lot, as you know that the startup India is there, then make in India drive is going on. And I think when we talk about entrepreneurship, or not even entrepreneurship, at least it is very important that these researchers are translated to for the benefit of the society. Very few people can take it to that level, and I think you will definitely do it. It is very very inspiring to know both of you. And so, coming to my last question, what would be your message to your young inspiring dental students and professionals?
I'm saying only one thing, that we have to become a competent in the subject.
Perfect. Very nice answer. Yeah.
But ma'am, I would like to emphasize a little bit more regarding this.
Yeah.
Ma'am, my professor in RMH Dental College and Hospital,
Hmm.
Dr. Joy Gopal Roy, he
Hmm.
used to say me one thing, that as is our pathology, so is our practice. So for the UG students, we'll be we're thinking about that we'll practice general dentistry only, or we'll do
Hmm.
some clinical subject and then we will continue our practice. I'll request them to learn pathology, the basic pathology, from the clinical perspective and the histopathological perspective also, so that they can at least diagnose any disease like oral cancer or any oral potentially malignant disorders at the earliest stage possible. Because
Correct.
if we do that, that will be a holistic approach to reduce the disease burden in our country. So that is a very much important thing to increase importance of studying oral pathology in UG students and make it more interesting, so that they don't feel bored or they don't feel afraid of the subject, because pathology, some people think that it's a little bit tough is at some point.
Hmm.
So that is one thing. And another thing, for the PG students, I will request every PG who are doing currently the MDS course in oral pathology, that explore the field of research.
And always
Right.
That is because if you do that, then you will definitely learn your subject. You will learn the disease procedure, how pathogenesis, how it is occurring, and as soon as you learn these things, you'll be able to apply your own knowledge or your own interest, and you will develop your interest definitely, because there are so many
Mhm.
interesting things in the field of oral pathology.
if
So
yes,
it is a growing field, and we are welcoming everybody to join us
and always
who
look,
are interested in
always
this.
look beyond or the out of the box. We
Yes,
have
yes.
to
Always think out
always
of the box. Always think out of the box, because I tell
have
everybody every moment that whatever I
think
know,
differently.
I think I am not that much competent for to become a dentist or doctor, because I always wanted to be an engineer before some times. But what I am today, just because my
Give 100%.
guidance, just because of
Yes.
guidance. Because every time in my previous college also and in this college also, there are some faculties who always inspired me that you know these things, this is good, now you need to apply these things in this field also.
Right.
So
Right.
they have been very much supportive.
Do your
So
best and do your 100% at least.
yes, you must dedicate your 100% to your subject.
Never regret.
Yes, never regret.
Fantastic. I think that's a very powerful message from both of you, that give your 100% to your subject and you will never regret. And I agree to it very much. And thank you so much, Sourendra and Kuldeep, for being on my show. And I think we will meet again in the future with some more interesting. And when you make more models, maybe. So that's very interesting. And keep making, keep working in the fantastic field that you are working. And I think you will be very good researchers, and I think it's a very, very bright future for both of you. And I wish you all the best, all success in your life in the years ahead. Thank you so much.
Lastly,
Thank
we would like to thank our faculty, our parents, and
Yes,
of
ma'am.
course,
Yes, ma'am. We will like to thank our faculties very much, because after doing so much
much.
hectic work of teaching us and doing other administrative jobs, they always
They
feel that they could have done
trying to
something more.
learn.
So this kind of guidance is much required, because they work so hard, and that inspires us to do the hard work. So we'd like to thank
Absolutely.
our faculties as well as
And
our parents
parents.
and everybody who supports us.
Absolutely. I think without mentors, we are nothing. So whatever we imbibe, what as you said, whatever we are today, after parents, I think that is what we represent. That
Yes,
is
ma'am.
what
Yes,
we
ma'am.
carry
Definitely,
I
ma'am.
forward.
totally
Absolutely.
agree, ma'am.
Absolutely
Yeah.
agree with you, ma'am.
Yeah.
Thank
Thank
you.
you so much. We'll meet again. Take care. Goodbye. Thank you, everybody, for joining in. And it was a fantastic crowd today. Thank you for all your lovely messages. It has inspired my guest as well as me. We got a lot of energy, and we will meet again. We'll come again. Be there on next Friday again on Eclectica, because this is going to continue. I'll bring another dental scientist altogether. Thank you so much, Kuldeep and Sourendra, once more. Good night. Take care. Bye bye.
Good night, ma'am.